WAVE91.7FM, Pawtucket. I am Destiny Rex Igiri. The Rivers State government has reaffirmed its commitments to strengthening primary health care delivery across the state. Deputy Governor Ngozi Odu gave the assurance during an oversight visit by officials from the Federal Ministry of Health and Social Welfare at Government House, Pawtucket. She described the federal monitoring framework under the Basic Healthcare Provision Fund as a vital tool for accountability and improved service delivery. The Permanent Secretary of the State's Ministry of Health, Justina Jumbo, also stressed the need for efficient utilization of funds and functional health facilities. Earlier, the leader of the Federal Steering Committee for BHCPF Gateways, Dakum Longje, commended the state's performance in primary healthcare delivery. Residents of Rivers State have raised concerns over what they describe as the slow pace of governance, saying the situation is affecting several sectors across the state. Some respondents who spoke to our My Demok crew in Pawtucket said key sectors were not performing optimally, adding that more needs to be done to improve service delivery. Others called on the state government to intensify efforts to ensure that the mandates given to the governor and deputy governor translates into visible impact for the people.
Because we have been in this mess for about 3 to 4 years now, which we need the help of government as well, especially the road and the light and the school, there's hospital too. And if you can see at the level here, everybody is complaining about the health center and people is dying. If you have an emergency to that hospital, I believe your person cannot survive that very day. And my business is close to where we have Thursday. For over 1 month, 1 month after, it was we are not being packed, and we expect a lot of fly all over our shop, mosquito and the rest of other things. The environment is polluted and we can't breathe well.
Meanwhile, other respondents stressed that good governance should be evident at all levels, urging relevant authorities to work together to strengthen democratic values and drive meaningful development.
The government should know their own function, because when it's social employees know their function, they need their headless. No employment, people are just walking around, but no government don't care. No hospital. When the people go work are working, the rest of the life are working. According to the parent place, they have to start to home. In Scotland, division of labor, this is why we have the councillors, chairmen, commissioners, pamphlets, and all the rest of them. Because the governor will not see everything. The woman, whatever it is, they should resume work. Port Harcourt is smelling. There's no light, there's no good road, there's no good air to breathe, not to kill us.
My Demok program comes up every Thursday by 11 a.m. on this station. Meanwhile, the Rivers State Ministry of Education has announced that all primary and secondary schools will resume for the third term of the 2025-2026 academic session on Monday, April 20th. In a statement, the Commissioner for Education, Dr. Peters Mwago, directed both public and private schools to strictly adhere to the approved resumption date. The government also emphasized that all schools must operate within the established academic guidelines, warning against any deviation from the official calendar. Private school operators have been specifically urged to fully comply with the government-approved schedule to ensure uniformity across the state's education system. Parents of candidates sitting for the 2026 Unified Tertiary Matriculation Examination (UTME) have expressed dissatisfaction over delays in the commencement of the exam at several centers. They said the late start disrupted their daily activities and business engagements, noting that many arrived early in line with scheduled times but were left waiting for hours.
In work according to the time, they said that they will start by 12. So this 12, the moment of the exam was not too bad.
They really stressed it. We are waiting for them. Because though if I would say it's lack of the facilities inside that they was. Because see now people that come in, they start by 12, same time they're coming, they didn't start immediately. They just standing, waiting, doing their calculating. So I feel like they should improve in the equipment or whatever they have this.
In the morning, I thought it would be by 8. But when she bring her this house, it was here for clubs. I have to leave home, go to my feet, so I have to come back by something after 2 or 3.
Some candidates also shared their experiences, saying that despite being scheduled for early sessions, the exams did not begin on time, leading to frustration and uncertainty.
This
bed is about to end.
It was okay, it was fine, no stress, though some questions were tricky. Because I didn't feel like I was not really nervous, like I was calm, so
it was not that bad. At first it was looking like there was enough time, but when it dawned on me that it was up to like 20 minutes more, I've never even touched English to full shop. I didn't face any issue. I loved him well, both my templates went well.
The UTME, conducted by the Joint Admissions and Matriculation Board, began on April 16th and is expected to end on April 25th, 2026 across accredited computer-based test centers nationwide. That was Rivers Report on WAVE91.7FM, Port Harcourt, compiled by Chiwinduwani. For reports and inquiries, send a text or call our newsroom lines 0911 347 5147. You can also listen to us on WAVE91.7FM.com. For pictures and stories on the news, follow us on Facebook next on 917 WAVE FM and WAVE917FM on Instagram and Threads. Remember, Nigeria is our only country. We should join hands to make it great. I am Destiny Rex Igiri. Thank you for listening.